Hey there, future nurses. Today we're diving into ABG versus VBG, a topic you'll definitely need to ace your Nclex exam. Let's break it down. First up, arterial blood gas, or ABG. This test measures oxygen, carbon dioxide, pH levels, and bicarbonate in arterial blood. It's all about assessing how well your patient's respiratory and metabolic systems are working. Key components: pH, normal range, 7.35 to 7.45. PaO2, normal range 75 to 100 mmHg. PaCO2, normal range 35 to 45 mmHg. HCO3, normal range 22 to 26 mg/L. And SaO2, oxygen saturation, should be between 94 and 100%. Now, interpreting ABG can be tricky. For acidosis, pH is less than 7.35. For alkalosis, pH is greater than 7.45. You've got respiratory causes like low PaCO2 for alkalosis or high PaCO2 for acidosis. And metabolic causes like high HCO3 for alkalosis or low HCO3 for acidosis. Common conditions: think respiratory acidosis from COPD or respiratory alkalosis from hyperventilation. Metabolic acidosis, maybe diabetic ketoacidosis. Metabolic alkalosis, could be vomiting or diuretics. Next, venous blood gas or VBG. It measures similar parameters but from venous blood. It's less reliable for respiratory function but handy for metabolic status. VBG components: pH, normal range 7.31 to 7.41. PaCO2 is typically higher. HCO3 stays similar to arterial levels. So what's the difference? ABG is more accurate for respiratory function. VBG is easier to obtain and good for metabolic status checks. Remember, pH in VBG is usually lower due to CO2 retention, and ABG is your go-to for oxygenation status. For the Nclex, know your normal ranges. Understand acid-base balance. Recognize conditions altering ABG-VBG results. And know your interventions like administering oxygen or managing ventilation. Quick practice. A patient has a pH of 7.30, PaCO2 of 50 mmHg, and HCO3 of 24 mg/L. What's the diagnosis? Respiratory acidosis. And what's VBG's primary use? Assessing metabolic status when arterial sampling is tough. Alright folks, that's a wrap. Understanding ABG and VBG is key for effective patient care and acing the Nclex. Keep practicing and you'll nail it. See you in the next video.